Let's welcome the Executive Director at the North End Community Health Centre, Rod Wilson. Come on in, Rod.
Can you tell me when to start?
Yeah, do you want?
Okay. Tell me. Hi, I'm Dr. Rod Wilson, a family doctor and Executive Director at the North End Community Health Centre on 2165 Gottingen Street. So thank you for the invitation to come here. In the next 4 minutes and 59 seconds, I want to tell you what we do, how we got where we are, and where our needs are. So before we go there, I want to take a story. It kind of describes the type of work we do. I want to take you to December 27, 2012, 11 a.m. On that day, I was working in our clinic, and one of our street nurses brought in this man, looked like an elderly man, from Metro Turning Point. Turns out he's not elderly, he was in his 40s, but he's spent most of his life in and out of psychiatric hospitals across Canada and somehow made his way to Halifax and been at Metro Turning Point for a year. On that day, when we're all stressed about Christmas, he had everything that he owned in 2 bags that he carried with him for the day. During the course of that visit, we discovered he had a medical problem that probably weren't going to emerge and probably weren't being admitted, but there was no way he was going to go to emerge. So myself and the street nurse came up with a plan with him that she would see him at Metro Turning Point and I would follow up in a couple of days. As he got up to leave, he started to cry and I'm thinking, oh my God, I've offended this guy, what happened? And I said, what's wrong? And he said, thank you for being so kind to me. So that was kind of what jumped me in wanting to take on the job as Executive Director. I'm often humbled when I think I'm having a bad day by the experiences that our patients have and the challenges that they face is incredible. Our patients expect or assume that we're competent, but they don't always expect healthcare providers to be respectful. So that's part of what makes our work interesting, exciting, and rewarding. North End Community Health Centre started in 1971. At that point, there was no services. Gottingen Street was changing. So it started as community members and a couple of doctors who started a clinic. It was fee-for-service at that time, and Dr. Margaret Casey was one of our founding physicians, and now she's our board chair. Since then, we've grown into a community health center. We have 2 sites. We have over 48 staff. We've got doctors, nurses, nurse practitioners, mental health workers. For 20 years, we've been providing also outreach services to federal offenders who come back mostly from Dorchester and are at one of the halfway houses here in the city. We also, 5 years ago, our flagship that we just celebrated, started our mobile outreach street health program, where our MOSH nurses, we have nurses that work 6 days a week and go to all the shelters, bring patients in to see us, or we go and see them, and they also provide care out of their van that goes around the city and sees people on the streets. So a lot's changed in the last 43 years. We've also been involved in some community development. We started a parent resource center about 15 years ago, which now provides help in Uniacke Square, and we were the birthplace of Hope Blooms, which has now gone on to be its own successful program. So we've been on Gottingen Street for 43 years. We want to be there for another 43 years, but there's challenges. We're a non-for-profit. The bulk of our funding for our core operations and staff is provided by the Department of Health. But as a non-for-profit, which we take great pride in having our autonomy, we're responsible for our building and our maintenance. We are in now what used to be an old Woolworths, I'm told, in the 40s and the 50s. It looks like a clinic on the outside or a health center, but it's had little attention paid for it. And we're now hitting a crisis, so your invitation came at a perfect time, if I may say so. We had a major leak in the roof this year. We've patched, but now we're facing a new roof. Our air conditioning went kaput in June for half the building, and half of our staff, mostly our business team, are working with no air conditioning and fans. And sometimes working from home because it's too hot. But where we need the most help is because of the lack of neglect. Our place inside hasn't been painted in 25 years. Our waiting room is now, the ceiling is cracked, peeling, and it's really quite embarrassing. Our patients expect very little from us, and so what we really want to create is fix up our center so our patients feel respected when they come in, they get the care they deserve, and can take pride in the health center. So that's where our need is, and that's where our ask is today. I want to thank you again for inviting me. Thank you for the work you do. As you know, nonprofits couldn't survive without you. We'll be visible in Gottingen 250. Please come down and see us. And I leave you with a quote that keeps me grounded from John Bradford in 1554 in the Tower of London: "For the grace of God goes I." Thank you.